We continue with our discussion about whether or not ChatGPT is actually useful in clinical setup. So this is one another prompt. Extract all symptoms only from the text below. Differentiate between symptoms which are present versus absent. Give me the probability that high, medium, and low of how sure you are about the result which you are outputting. So that means we again give certain history and symptoms, and we are planning to use ChatGPT as clinical decision support assistant, and we want to test how far it goes. We are asking, give a note on probabilities why you think a particular diagnosis is true, then output everything as a table. We are also asking, expand all acronyms so that maybe some layman can understand, and output the acronyms as a separate table. 60-year-old woman. Now you can see actually that this is how doctors actually write. This is written by a doctor, as we saw in previous lecture, Miss Ranjani Ramamurthy. So 60-year-old woman in NAD with H of CAD. Now obviously we may not understand everything, but one doctor, these are standard acronyms used in medical profession, and one doctor who has written this and another doctor who reads this, they will immediately be able to understand. Now the test is whether ChatGPT can understand all these or not. Okay, so this is the complaint. SBP and HTN for at least, here it was at least actually, at least for 8 years, awoke from sleep, and this is the basically this was the history. And now the symptoms, sore throat and swelling of tongue and all that. Now she came immediately to ED. B oblique C. We don't know again what is that B oblique C means in this medical terminology. She was having difficulty swallowing and all that. Now we are asking it that more and more history. She says that she feels like it is swollen down esophagus, and she does not recall vomiting and all that. In the ED, she was given 20 milligram this particular medicine, and so. Now let us feed this history along with the prompt, and let us see if ChatGPT can indeed work as a clinical decision support assistant. Okay, so you can see that based on symptom, whether those symptoms are present or absent, it has given you output, it has given you probability, high, medium, etc. And you can see how easy it is for the doctor. If somebody, some of her assistant, instead of writing in this format, presents these in this format, how much time it will save for the doctor. That and it also gives the reason why probabilities are assigned and what is the logic behind probability. Probabilities are also subjective to the symptoms based on information provided by the patient, and like that. So why it has assigned medium probability to certain things very clearly, so we can understand what this column means. Okay, now let us go one step further. Mm, yeah, in this answer perhaps there was that SPB. No, SPB is not there, but in the BP. Okay. So in the answer it was not there, but in the history it was there, SBP here. So now these doctors wanted to test that SBP can also mean systolic blood pressure, and SBP can also mean spontaneous bacterial peritonitis. The question is, a trained doctor will be easily able to understand what SBP means based on this history from the context. Now the question is whether ChatGPT can understand this context and properly expand. So we are asking it that why did you took this SBP as systolic blood pressure only? Otherwise, one of the possible expansion can be these also. Why you did not include this spontaneous bacterial peritonitis? Okay, let us ask that. You expanded SBP as systolic blood pressure. Why? Now here it is saying apologies for the incorrect. So here ChatGPT got confused actually, but when they did here actually I can show their blog. Um, yes, here somewhere. I think they highlighted certain things, so that might be the reason. Here they challenged it. SBP was part of the clinical note. So they challenged the chat GPT that whether disambiguation can be achieved by chat GPT or not. So SBP is here is the explanation. In this context, what is the possibility of this? And tell me why. Okay, so let us ask that question to ChatGPT. In our patient's context, what is the probability that SBP means systolic blood pressure, and why? Yes, it is saying that the probability is high, and this it is giving this reason also. And actually those writers of those blog, they were actually researchers. So they said that we tried to confuse chat gpt at least 10 times. So we went back and forth a bit, but the system remained steadfast, and it maintained that the probability of systolic blood pressure was higher. So, given that spontaneous bacterial peritonitis is also a common infection for patient with cirrhosis of liver, and but cirrhosis of liver is not in patient's history. So that is how it is. It could successfully do differential diagnosis, and it could successfully uh, expand what does SBP mean. Okay.